afternoon, everybody, and welcome. It's nice to be back. And in the custom of these meetings, I will throw the floor over to Dr. Fitzgerald in the first instance for today's update.
Thank you, Minister. Good afternoon, everyone. Thank you for joining us today. We'll start with an update. Since the media advisory yesterday, we have no new cases in the province, and the total number remains at 270. 266 people have now recovered, and in total, we've tested 33,892 people. Today marks the first day of school for many kids in our province since classes were suspended in March. A lot of planning from government, public health, the school districts, school administrators, teachers, and parents have prepared us to welcome students back to school this week. We all want the best for our children, including making sure they feel safe, healthy, and happy in school. Throughout the year, we will all continue to work together to make sure this school year, albeit different than any other, is a successful one for our kids. School and interaction with their peers are important for our children and youth overall well-being. Right now, across our entire province, we have a low prevalence of COVID-19, and that, along with the school safety protocols in place, make it safe for full reopening of schools to welcome all of our kids. While schools are fully reopened, attendance at school is recommended for all children, including those with immunocompromising conditions who would normally attend school. For families who have children with such conditions, I would encourage you to review the back-to-school materials available on our website at gov.nl.ca/COVID-19 and the information provided by the school districts. If you still find that you have questions or concerns about sending your child back to school because of their condition, I would encourage you to speak with their healthcare provider. They will be best positioned to provide advice specific to your child's condition. As our children and also parents get back to their full routines, I encourage you to talk with your child about their experiences and how they are coping at school. Like in other school years, kids experience a mix of emotions at this time of year. They are excited to see old friends, but they can also be nervous, particularly if they are going to a new school. They think about who will be in their classroom, who will be their teacher, what activities will they want to be in this year. Talking with your child about their feelings will help them to identify and label their emotions, and this will help you help them to process what they are feeling. If you would like more information to support you and your family, please visit bridgethegapwith2ps.ca to access a wide range of locally available, confidential, and free mental health and addictions programs for people of all ages. This year will be different. We will see changes. We will ensure the education sector is supported with the most current available public health advice. For example, there will be more information provided about music as it relates to choirs, singing, and wind instruments later today. As with all change, it is important for parents to take some time to reflect. This virus has upended many aspects of our lives, and it has left us feeling uncertain at times. Be kind to yourself when you don't have all the answers. Certainly, you are not alone. This pandemic has pushed us all out of our comfort zones. Be flexible. This pandemic has taught us many lessons, and being flexible to respond to what comes our way is definitely near the top of the list. Be understanding with others as they strive to figure out what makes sense for them and their families. Remember that while we're all on this journey together, we may be walking different routes, and some of these routes are more challenging than others. Next week will mark 6 months since our province declared the public health emergency. It has been a long road, and I know it has been tiring and at times immensely trying. Change at the best of time is challenging, and COVID-19 has brought us with it significant hurdles, and we've conquered these together. Since the pandemic began, we relied on our basic public health guidance, practicing good hygiene, maintaining physical distance, ensuring frequent hand cleaning and disinfection, and limiting our contacts outside of our household. These practices, along with public health measures such as requiring travelers to self-isolate upon arrival, and most recently requiring people to wear a mask in public spaces, have enabled us to significantly control our case numbers. Our province has done tremendously well in adhering to the public health measures, and all of this combined gives us confidence that we can continue to gradually relax some of these measures. So with that in mind, effective September 10th, 2020, I am relaxing special measures Orders 9 and 10. These measures prevented staff in personal care homes and long-term care facilities and assisted living facilities from working in multiple locations and from working in another job while also being employed in one of these settings, except in exceptional circumstances. For more details, please visit our website to view the updated special measures orders. We are well positioned to relax these measures today, and should we see a change in our epidemiology, we will revisit this public health measure in the interest of protecting the health of those who reside in these facilities. Further, I want to advise that there have been COVID-19 outbreaks declared at both Syncrude's Mildred Lake oil sands site, located near Fort McMurray, Alberta, and Suncor's base plant located north of Fort McMurray, Alberta. I'm asking workers from these facilities returning to Newfoundland and Labrador to self-isolate away from their household contacts, household members, and call 811 for further direction. This includes workers returning from Syncrude since August 14th and those from Suncor since August 8th. While the 2-week self-isolation period may be over for some of these workers, we would still like them to contact 811 to follow up. Symptoms of COVID-19 include fever or signs of a fever, cough, headache, sore throat, painful swallowing, runny nose, diarrhea, loss of sense of smell or taste, unexplained loss of appetite, and small red or purple spots on the hands or feet. As a recap for those who may have just joined us, we have no new cases since yesterday's media advisory. The total number of cases in the province is 270. The restart of school is another important milestone of life with COVID-19. We must remain vigilant in our efforts to keep the risk of spread of COVID-19 low. We have done so well here in Newfoundland and Labrador in adhering to our public health measures, so let's keep on the path and learn not just to live with COVID-19, but to thrive in spite of it. Thank you.
Thank you very much, Dr. Fitzgerald. We have with us today Minister Tom Osborne, who is the Minister of Education and Early Childhood Development, and I'd like to call on him now to make a few comments. Tom?
Thank you, John. It's been a very busy day today for parents and students and everyone involved in our province's education system. Students in grades kindergarten through 12 and our young adults attending our public and private post-secondary institutions are experiencing their first day of classes today. Many adjustments have been made under the leadership of our Premier amidst the COVID-19 pandemic to ensure that students of all ages can resume their learning and enjoy a successful school year. Our K-12 schools have reopened under Scenario 1, in-school classes with health measures in place. Working with public health, the Newfoundland and Labrador English School District and the Francophone School District prepared detailed plans for the reopening of schools. Since administrators, teachers, and staff returned to school on September 2nd, there has been a lot of communication between schools and students and families. There's also been much work done to address issues and ensure the smoothest transition back to the classroom as possible. This includes added measures such as additional busing, teaching resources, technology supports, and additional cleaning and hygiene in our K-12 system. At this point, the additional custodian positions we announced are in place. The school district also recruited additional custodial staff earlier this summer, so in total, there are 80 additional custodians now in place. There has been an additional 25 guidance counselor positions and 15 administrative positions allocated. There are now teachers in these positions. The English School District is working through the process of hiring the 10 teachers for virtual learning. The district is anticipating having these positions filled within the next week or two. With the added investment of $1.6 million, there will be an additional 285 hours of student assistant time per day. all of these hours will be in place before the end of this week. Both the district and contractors are actively recruiting drivers to help deliver additional busing services. We are making significant progress on busing and reducing the impact on as many students and families as possible. To date, we have reduced the number of these affected students by over 1,000. The number of those impacted will continue to decline in the days ahead, and we will have all eligible riders accommodated by the end of the month. I understand that the timeline is not addressing the immediate needs of some students and their families who, for example, may not have their own transportation. I appreciate the difficulty that this presents, and I can assure you every effort is being made to resolve it as quickly as possible. Public and private training institutions have also undertaken significant work to prepare for the safe delivery of programming, working closely with the provincial health officials. Memorial University and the College of the North Atlantic will continue with primarily remote online programming through at least this fall. 13 private training institutions are planning a full return to in-class and practical training. 9 private training institutions will continue remote online programming with some on-site practical training. There is no doubt that this school year is like no other, and it will certainly look a little different. While it's exciting to return to school, it can also cause anxiety. As I've said before, we as parents and educators, it is more important than ever before that we help ease and reduce these anxieties, and when necessary, help students deal with the anxiety. Everyone involved in education has been working hard to make sure the return to school is as smooth as possible. No doubt, there will be some hiccups. Our schools will look different. We may have to use different entrances and exits. Recess and lunch may be different. As we get used to the new normal at school under COVID-19, it is important that we all remember to be respectful and to listen and be patient. We continue to meet regularly with our partners in education to address issues. The health and safety of our students, the staff, and educators remains a priority. And while things will look different, parents and educators can be confident in the planning and measures put in place for a successful school year. Through the planning, additional measures, and the guidance of Dr. Fitzgerald, our schools are safe, our students, educators, and staff are safe. Providing a source of normalcy is part of learning to live with COVID-19. A return to school is a positive step for students, allowing them to connect with friends and teachers and continue their learning in a safe environment. If our current situation changes, we are ready to make adjustments quickly, to follow and implement any new guidance from public health. Thank you to the leadership of the K-12 school districts and our post-secondary institutions, as well as all educators and staff for your commitment to our children, youth, and young adults during this extraordinary time. By continuing to work together, we can help ensure a positive experience for everyone. Thank you.
Thank you very much, Minister Osborne. And again, it's day 186, and we have one active case in the province. I have some remarks. Before I get into those, I'd just like to thank all the well-wishers who noticed my absence and wish me well to come back. So here I am. in the flesh, or virtually anyway. From the point of view of the topic of the moment, the return to school figures very prominently in the minds and hearts of the families of this province. And the only thing I would add to what Dr. Fitzgerald and Minister Osborne have said is that, there's a very nice video Dr. Fitzgerald did speaking directly to students, particularly some of the younger ones. And I think if there's any doubts in parents' minds that access to that and showing that to your younger children will actually go some considerable way. It's had some very positive reviews on social media and on my Facebook page for sure. My comments today will just touch on a couple of things. We've heard a bit about rotational workers over the last little while. And from our point of view, for those who rotate across Canada from Newfoundland and Labrador, we have tried our best as the situation has changed to strike a balance between the benefits of shorter isolation periods for the workers and their families, but also the risk of transmission, bearing in mind what the disease is doing elsewhere. We've seen British Columbia flare up to the point of having to lock down nightclubs and bars again. And Dr. Fitzgerald has just mentioned those 2 outbreaks in camps and areas that may be relevant to some of our local workers. So again, we've made at least 2 adjustments, relaxations over the course of the last few weeks for rotational workers to try and make their life and their families' lives easier. One group we don't really have as much latitude with are those Newfoundlanders and Labradorians who rotate to international jobs. International travel is under the jurisdiction of the federal government, and whilst we as a province can add to the requirements of the feds, we don't have the ability to take that away. The Quarantine Act is federal legislation, and that at the moment requires the isolation period set out by the federal government. We continue to discuss that with our federal counterparts at the FPT meetings, but as yet there's been no movement from them on that. The other issue that has come up recently was around today being the first day for rotational workers to access testing. They've experienced some challenges with the phone system. We had a rather bizarre situation where calls from 811 looked as though they were actually originating in Russia. This has been pinned down to a software issue with Bell and the carriers, and they are actively working to try and remedy that. It wasn't anything within our control. In terms of calls to the booking line in Eastern Health, and this is peculiar to Eastern Health, there were challenges there around staffing. It's now staffed from 8 a.m. to 8 p.m., and the issues around callbacks and voicemail and messages are being worked on as we speak. So hopefully that situation will improve over the next few days. I think the load was simply, in part, also exacerbated, made worse by the load of individuals who had been waiting for the opportunity to call. From a health point of view, one of the changes that we brought in to protect our most vulnerable citizens in the light of experiences elsewhere, we introduced one worker, one home policy. And as Dr. Fitzgerald says, tomorrow that will be lifted. That will allow those people whose income was hit because they could only do one part-time job rather than the 2 they may have had. They will now be able to work towards restoring that. The other issue is around services that are provided in long-term care and personal care homes by people from outside businesses. I'm thinking of hairdressing and that kind of thing. That can now resume without any further challenges. Again, as Dr. Fitzgerald said, these measures can be relaxed only because of the diligence and hard work that we've all done to get to where we are now, and the situation around us. And one of our challenges and one of our concerns is what's happening elsewhere in the country. As the numbers start to rise in other jurisdictions, we have to seriously consider the implications for Newfoundlanders and Labradorians living here. So that's something we need to keep an eye on. So conscious of the time, I think I'll stop there, Kathy, and hand it back to you to manage the questions.
Thank you, Minister. For the benefit of our speakers, we have 5 reporters registered for today's call. We will run through a series of 3 rounds of questions where each reporter will have the opportunity to ask 1 question and 1 follow-up. And we know that we've allotted half an hour for this event, but we will go over in order for each reporter to be able to ask all of their questions. Our first questions today are from Kellyanne Roberts of NTV News. Please go ahead.
Thank you. In terms of the busing situation, we know it's to be remedied by the end of the month, but was there any way of considering who was going to get the passes earlier this month? I know initially it was the furthest 46 on the route, but we've had some instances. We've heard from one father who was given an exemption for self-isolation from Transport Canada and had to return to the province to drive his kids to school because they had no seats on the bus.
Yes, so there are different routes, and while one route may have students that live closer than another route where students were impacted that were a further distance away from the school, it's actually done by route. The buses can accommodate 46 passengers now, as there are only 2 students per seat. So I know this has been a difficult and challenging time for many parents, but we're certainly working hard to address the issues, and as quickly as resources are put in place, we're implementing the additional busing and accommodating students.
When it comes to the rotational workers, Minister Haggie, you noted today was the first day that many of them could begin to get that early testing done. Are we looking to expand testing to most people to do something similar, that on their 5th or 7th day of self-isolation they could also get tested?
Rotational workers are a particular special case. They rotate. They spend a considerable amount of their time in a different environment, though, because of the nature of their work. So the camps are screened and supervised in ways that is much more rigorous than the general population. Currently, we have made these changes only for rotational workers, and it's a pilot, 4 weeks or thereabouts, to see what happens to our numbers during that period. And we'll reassess matters at the end of that. But there's no intention at the moment to change things any further.
Thank you.
Our next questions are from Peter Jackson of The Telegram. Please go ahead.
Hi. With regards to resources and rotational workers, there are literally thousands of them in province coming in every day. Was there no thought to increasing resources for 811 and these others before today, or it seems like to be a bit of a reactive measure?
The 811 issue was actually more related to issues within Eastern Health. Eastern Health runs a slightly different system in that they have a central booking line for their appointment. They had some challenges there, and we're working through those with Eastern Health. 811, as far as I'm aware, has the capacity to ramp up and ramp down as the call volume alters. Indeed, I would refer you back to the beginning of the pandemic, where they were dealing with 2,600 calls a day and more, and did so very well. So the issue is a bit further down the line, and we're working through Eastern Health challenges with that.
Okay. And I guess this would be for Dr. Fitzgerald. There are a lot of rotational workers who are just wondering, and I know this has been brought up before, why it's okay for their spouses to go to work, say, in the hospital, for their kids to go to school, and yet they represent such a threat that they have to self-isolate. Are there any restrictions placed on families of rotational workers?
So as long as the rotational worker is not symptomatic, families are allowed to go to work and go to school. That's been in place all along. Well, not school, but work. So, that's not really changed. And certainly if the rotational worker becomes symptomatic, that's a different story. And then, we have to have testing done, and then their families will have to get tested and isolate as well. So if they prove to be positive. So it's only for asymptomatic workers that can happen.
Thanks.
Our next questions are from Meg Roberts of CBC News. Please go ahead.
Minister Osborne, every child should have a right to an education. So what do you say to those parents who cannot send their child to school because of a transportation issue?
It's heart-wrenching, actually. I know in discussion today with the English School District, they're looking at doing some double runs or triple runs where possible. It may mean a shortened in-class instruction for some students, which is unfortunate, but that would be a short-term measure until the additional busing is in place, so that every eligible rider will have transportation.
I'm sorry, I missed the beginning of that. So you guys are considering maybe staggering the times or having two bus routes?
Well, no, in some cases, as a shorter-term measure, where practical, if we're able to, we're looking at doing additional runs, which may mean a shorter time, in-class instruction time for students. We'd looked at the possibility of doing earlier runs, not shortening the time for students, but that wasn't possible.
Okay, thank you very much.
Did you have a follow-up question?
Oh, I believe that was my follow-up question.
Oh, I thought that was like you were reiterating that you couldn't hear what he said first.
No, sorry, I've had two questions, but I will come back around.
No problem. Our next questions are from Brian Medore of VOCM News. Please go ahead.
Hi, Minister Osborne. Just wondering if you can expound on a statement you made that if things change in our school system, that you will be able to make adjustments quickly. Teachers I've spoken with the last little while say they really are not ready for anything beyond the physical presence in the classroom. Can you just expound on that, by what you mean by that?
Certainly. I know that the English School District and public health officials, the Department of Education put forward guidelines and plans to deal with the school year. So right now we're in scenario one, which means in-class instruction. If the situation changes in a particular school or in a community, we can quickly move to scenario two if need be, or to scenario three if need be. Scenario two would be partial in-class instruction and partial at home, or scenario three would be full-time instruction from home.
Further to the school. Busing situation, quite a few stories on Open Line this morning, situations where a school bus, far less than half capacity, bypassing children waiting for the bus because they are not eligible under the system. At least two situations where that happened. How does that happen, and do you look into that to see what happens in that case?
Yeah, certainly. I understand that those cases were what would ordinarily be courtesy busing. So on any year, any normal year, this year is a little different naturally, but any normal year, courtesy busing is usually looked at a day or two after school starts, so that principals and administrators can determine the availability of additional seats on buses and then offer them up to courtesy passengers. So this year, in that regard, it's no different. Today, it was eligible passengers only on the buses. Not all parents put their children on buses today. Some of them may have driven them for the first day of school. Maybe some parents will continue to drive their children. So in order to have a full understanding of the available seating, it's usually a couple of days after school starts, and then the school administrators have the ability to look at courtesy busing then.
Thanks.
Our next questions are from Patrick Butler of Radio Canada. Please go ahead.
Hi. First question for Minister Haggie. Related to, you referred to it a little bit at the beginning, the call wait times for people who are looking for testing. A lot of people complaining about that at the moment, and say things are getting better, but we're in a situation right now where we have very low prevalence. Is the province ready to, have an uptick in calls related to testing in the event of an outbreak?
The short answer is yes. I mean, I think what you've seen here today is an unfortunate coincidence of a lot of people kind of backlogged because today was the first day they could ring, combined with, in Eastern Health, challenges on the back end in meeting that volume. But the short answer to your question is yes, we do have the capacity should we start to see an uptick in cases.
And I'd like to ask a question on the border as well. Is there any change to the province's disposition in terms of border controls at this time?
No, none.
We'll now start question round 2 with Kellyanne Roberts of NTV News. Please go ahead.
Thank you. I'm wondering, since the COVID-19 tracking app has now been released, what the uptake levels have been like.
That's a very good question, and I'll go and find out for you. I don't have that number to hand yet.
No worries. Thank you.
Kellyanne, did you have a further question?
Oh, I do. Yeah, I wasn't sure if we were going with one or with two there. Sorry. Just looking for clarification. What were the camps for those rotational workers returning from Alberta?
Yeah, just 1 second now. So it's Syncrude's Mildred Lake oil sands site and Suncor's base plant, both located near Fort McMurray.
Thank you.
Our next questions are from Peter Jackson of The Telegram. Please go ahead.
Hi. I just want some clarity about you say that you have teachers hired for virtual learning, but there is no exclusive online platform offered for education. Why was this not considered, and how, if it's not actually in place, how quickly could you really move to that?
Right now, we are hoping that we'll have in-class instruction, the emotional, the physical health, the mental health, well-being, and educational, the best interest of our students. So we are looking at in-class instruction for our children. The virtual learning resources that we're putting in place are for immunocompromised. If a doctor recommends, because a student or a family member of a student is immunocompromised and should not attend school, that's what the current virtual learning resources are in place for. If we have to move to scenario 2 or 3, we are able to look at additional resources. We will put those resources in place at that time, but it is obviously in the best interest of students from a social, emotional, mental health standpoint to be in class and do in-class instruction. It's better for their education, I believe, as well.
Okay. And I also wanted to ask Dr. Fitzgerald, you said you have more information later today on singing, choir singing and wind instruments. And when would that be released? And is that being released just to the public now, or is it going to be news for everyone, including music teachers?
Yes, so this will be guidance for group singing and people playing wind instruments. So it will apply in a variety of settings, and that guidance will be available on the website. It's just going through the final approval process as I left to come over here, so hopefully by the end of the day we'll have that up.
Thank you.
Our next question is from Meg Roberts of CBC News. Please go ahead.
Dr. Fitzgerald, I'm just wondering, what would it take to shut a school down?
So that's a good question, and certainly those are things that we grapple with all the time. There are, first of all, I just want to reassure that there are processes in place for contact tracing and for dealing with cases of infectious diseases in school. And this is not something that's new. This is the work of public health, and it has been all along. So, we do have cases of other infectious diseases where we have to do contact tracing and that sort of thing. So the same principles will apply to COVID-19. I think it will depend on, certainly when we look at, the number of cases in a school, we'll have to determine, are these cases only in close contacts? Are we seeing more community spread? It will depend on what's happening elsewhere in the community as well as to whether or not we close down a school. Sometimes those things can be very localized in their context, so it can be difficult to sort of give a broad overarching, here's the number that we're going to shut down a school, because it's not quite as simple as that. Certainly we are working through that now in public health, and that guidance is something that we'll be able to talk a little more in detail about in the coming days.
Can you go over step by step what would happen if a student tests positive? Like, what's the plan?
So if a student tests positive, then public health is notified. So as soon as we have a positive result at our lab, we get notified in public health, and then the public health officials will contact the parents of the child, and they will get a list of people that child has come into contact with, and then they will do contact tracing. So then they will talk to, I was going to say contact the contacts, but that's starting to get confusing. So they'll talk to the people, who are considered to be close contacts of that child, and that could be people who are in class with that child, or maybe other close contacts that they would have. And then they would determine, how close the contact is. Is it a higher risk contact or a lower risk contact? And then recommend testing as with regard to that. And then in consultation with the regional medical officers of health, they'll determine exactly, what the process has to be for the school then in that situation.
Thank you very much.
Our next question is from Brian Medore of VOCM News. Please go ahead.
May sound a little bit trivial to some, but I'm just curious as to why, say, if a student forgets the lunch, and it's going to happen somewhere at some point, that a student will be in school without a lunch, parent will not be able to get there, why that child would have to come out of school and gone home for lunch or wherever, instead of just someone being able to drop something off. The child comes out of the school for 30 seconds, Johnny or Susie, mom, dad, or neighbor drops off a bag lunch, and back in they go.
So
is there any insight into that, or is that too school specific?
So yeah, I think it's, certainly from a public health point of view, I can't really comment on how that has to operationalize within a school, but I would certainly leave that to the discretion of the school administrators to decide what works best for them.
There's a French school on the Port-au-Port Peninsula where the grades have been lumped in. I think it's 3 grades altogether, which seems to kind of go against any semblance of cohort. How does that happen, and what would be the rationale behind something like that?
In that particular case, they have the proper teacher allocation for the school. It's a recruitment issue. So I know the Francophone School District is trying to recruit, but at this particular time, while the teacher allocation is provided, the teachers aren't there.
Thanks.
Our next question is from Patrick Butler of Radio Canada. Please go ahead.
I have another busing-related question. 46 kids is the limit on the bus now. That's two kids per seat, which you would think would probably be the maximum you would want on a bus anyway. Any more than that would seem to be kind of overcrowding, according to a lot of parents. Once the pandemic is over, once we move out of these measures, are we going to keep those limits on buses, or are we going to go back to the old system of having up to 72 kids on a bus?
These buses are designed as 72 passenger buses. That's what they're manufactured to be, and they're inspected, by the provincial government here, Transport Canada, and they are permitted 72 passengers.
And just to follow up on the border, when is the last time that the four leaders of Atlantic provinces actually would have sat down to talk about this? Just curious about when these discussions actually have taken place in the last few weeks.
I couldn't speak directly to that because I haven't actually been on deck, Patrick. My understanding is that's been done through a combination of the Premier's office and Labrador Affairs, and I would suggest they would be better placed to answer that question.
Kellyanne, do we have any further questions?
Yep, I have one regarding the hospital in St. Anthony. We've had several people call in to notice us that most of the areas are closed there, including the wheelchair-accessible bathrooms on the main floor. I'm wondering if this is a COVID-19 measure that's in place or just a facility management issue.
Again, I wouldn't be able to speak directly to that. It sounds more like an operational issue. Maybe the CEO or the communications people at Labrador Grenfell will be able to speak specifically to which bathrooms are open.
Thank you. And in regards to the changes to the special measure orders regarding workers working from hospital to hospital or healthcare center to healthcare center, why was that decision made now?
So I think we've certainly been looking at epidemiology, and it has taken a bit of time for us to work through. When we think about personal care homes, long-term care facilities, it's not just as simple as making an order. It's there's a lot of things to consider, and so it's taken us a bit of time. We wanted to make sure that we've done the proper consultation and that we discussed things with stakeholders, including people who live in these facilities or who have families who live in these facilities. And so it took us this long to come up with an answer.
Thank you.
Peter Jackson, do you have any further questions?
Yes, sorry. I wanted to ask about the workers in long-term care. Are there any restrictions now as to where they can work other than their current position? For example, can they work in another healthcare facility, that sort of thing?
As of the change in the orders, that will not be the case. They will go back to status quo before.
Okay, thank you.
Peter, do you have a further question?
No, that's fine. Thank you.
Meg Roberts.
I just have one going back to the buses. I just want to know when we will know if more runs is possible, as it is already the first day of school.
I had a discussion with the English School District today, and the issue with runs right now is to put additional runs in place would mean a shortened work or a instructional day for students. I know the English School District had looked at the possibility of additional runs without a shortened work day, but that wasn't achievable.
And why not?
They had discussion with the NLTA early on, and it's my understanding the length of the workday for teachers, that issue was non-negotiable.
Thank you very much.
And Meg, was that your final question?
Yes, it was. Thank you.
Okay. Brian Medor, do you have any further questions?
I do. On the school bus situation, I spoke with Citywide yesterday, and they've acquired, I think it's 35 new or late model buses to be delivered within the next week or two. Is that where government and the school boards are headed as well, to acquire buses in that supply line, new late model, or you're looking at the older buses refurbished kind of thing?
There'll be a combination, I think, Brian. It depends on the contractor and what they're able to acquire. We'd gone, the English School District, the department, we reached out to the busing contractors and to ensure that we could acquire enough busing resources to accommodate all eligible students and some of the courtesy students once the eligible students are looked after. So it really depends on what the busing contractors were able to acquire.
And Dr. Fitzgerald, this one may be for you. I'm not sure if you're aware, if you know. There apparently is another TV production filming in the region. It's, I think, for the Sci-Fi Channel. The name of the program escapes me right now. Are we aware of that? And is there a protocol that they would have to follow before coming in here?
So certainly there are protocols in place, and there are, there's a guidance available on the website with regard to safe business operations. I would expect that most of this has been taken care of through the business response teams. I can't speak to anything specifically.
Okay, thanks.
And Patrick Butler, do you have any further questions?
I'm good, thank you.
Well, thank you very much, folks, for tuning in today. Please join us again on Wednesday, September 16th at 2 p.m., 1:30 in most of Labrador. Have a great evening.
Thanks.